want to talk to all of you men who might be experiencing a peculiar sensation and look of the penile region. And we're going to be talking about something that's called hard-flaccid. And there are many, many men, so I want you guys to know that you are not alone, but many men who are suffering from this condition. And so we're going to talk about it. So basically what it is when you see that, hey, your penis is actually hard, but it's in its flaccid state, meaning it's shortened and it's small, but it's hard. And you might be wondering, what in the world is going on? Is this erectile dysfunction? I'm not that old, I'm young, I'm in my 20s, 30s, maybe 40s. This shouldn't be happening. And you're probably wondering, why is this happening? So hard-flaccid is basically this term that basically means that the penis is basically hard in its shortened state. Sometimes it can feel rubbery. It feels it doesn't feel like your normal penis anymore. It's hard, it's rubbery. You're probably potentially noticing that your ejaculation isn't right either. Maybe it's weak. It also may be accompanied by other things that you might be feeling. Because oftentimes this hard-flaccid actually accompanies change in urination. So it feels like your urine stream is weak. It might feel like you have some urinary retention or hesitation, meaning you can't your urine stream feels weak. You might also be having constipation and rectal issues, maybe rectal pressure in and around the anus or in that saddle region between where the scrotum is as well as where the anus is, in that region in between. You might feel like you have a golf ball there or some just tension. You might feel just in general that your sexual function is just not where it used to be. You're not having regular erections, or it takes a longer period of time to reach a state of erection. And some of you might have ejaculation issues as well. So again, it's either weak, you might be experiencing pain after ejaculating, and then really anything in between that interferes with any type of urination, having a bowel movement, and being able to have sexual functioning. So you can have, these are just some of the things that can be going on, but many, many times there's a combination of a lot of different things going on. It's not uncommon to also hear that people are also having issues in and around possibly their low back, their hip. They might actually also have pain with sitting, so maybe even tailbone issues that you might be sensing. And some of these things may have started with one thing, but now it's starting to involve layers of other things that have developed over time. Or perhaps it could have been that this started with a bladder issue. It may have started with a highly stressful issue, maybe. And it kind of set this chain reaction off, and now you're in this state after maybe a year or two, or maybe just even a couple of months, that now you're developing this hard-flaccid. Now, I know a lot of you, the question that you're asking is, why is this happening? Like, this just seems so bizarre. And I'm sure some of you may have already seen a urologist. They're not really seeing anything going on. Some of you may have been put on prophylactic antibiotics because, again, there's no true infection going on, but they just wanted to see, well, maybe there is something. We're just not catching it on a urine analysis or blood testing. All of that's been negative, but we're just going to start you on antibiotics. And you're maybe noticing, antibiotics aren't really getting me anywhere. They might help for a little while, or they help a little bit, but then everything just starts to come back. So why in the world is this happening? So first of all, the cause behind why this can happen can be many, many different reasons. And the reasoning, I'm going to talk about in a minute, but there can be many, many causes behind why this can happen. Among just a few examples, it can be anything from stress to excessive masturbation, and then a bunch of stuff in between. And the reasons why this is happening, the big cause of it, a big chunk of it, is actually these muscles called your pelvic floor. Now, again, this is a female model, okay? And the muscles of this area are no different in a male and a female, except for the fact that for a male, you're gonna have a penis here instead of a vagina. But everything else in terms of the musculature is the same. But these muscles, which lay between your pubic bone and your tailbone and both of your sit bones right in through here, this kind of area that almost looks like a hammock, right, from here to here, those muscles are called the pelvic floor muscles. And those muscles, just like any other muscles in the body, can become problematic. And when they become problematic, they can basically become tight, they can become painful, and they can cause a lot of physical changes that can include bladder, rectal, sexual functioning, and yes, changes in texture of the penis. And as of now, my staff and I, we have somewhere between 18 to 22, now probably 23 years of experience treating lots of men with this type of problem. And just to reiterate again, this is very, very common. So I want you guys to know you're not alone. You're not crazy. If you have seen a urologist and they're not finding anything, again, it's probably because they haven't considered that these muscles can be a big problem. And because they're just like any other muscles in the body, you have to treat them and they need to be treated. And this is what, we do here at our clinic all the time, where we're treating men with these types of problems. And I've heard so many different things, from everything that I've talked to here to even more, in-depth issues that are going on with men that they had no idea that some of these other symptoms were related to what was going on. And I do know for many of you, this can be, something very mild that's causing mild problems in your life. But I also know that this can be something that can put you in the brink of like severe depression and relationship issues. So I know that because we hear it all the time and we see it all the time. And just to let you know, there can be successful treatment in getting this better. And a lot of it starts with really fully understanding and knowing that this muscle, or these muscles, because it's actually a group of muscles, are involved, and they can tie into a lot of other issues that can be everything from your low back to your hip to the low back area. This can happen to everyone from their late teens, possibly even early teens, all the way up into 80s and 90s. So it can, it can happen to all different types of age ranges, body types. Oftentimes this can also be due to excessive working out. And we're going to talk about a lot of this stuff because a lot of this is in the realm of what we do as specialized physical therapists in this area. But this is not very common in the medical world to really know what's going on and how to treat it. Have a wonderful day, and I'll see you on the other side.